Hello friends, let us now learn some important points about the pleural effusion. So, pleural effusion. Actually, in pleural effusion, as we have already said, the lung is bound by the visceral layer. This is the visceral layer of pleura, which is enclosed, which is covering the lung, and there is parietal layer of the pleura, which is covering the lung again. The outer layer is parietal layer, the inner layer is visceral layer. Between parietal and the visceral layer, we have this fluid, okay, which is actually a lubricating fluid which is present between the parietal and visceral layers of the lung. Now, what happens in pleural effusion is that this fluid which is present, it will increase, the fluid will increase, thus pushing or compressing the normal lung. Okay, so first and foremost, the first appearance which you see in pleural effusion is this is the costophrenic angle. This angle which you see here, it is called as costophrenic angle. Why? Because this is the phrenic, that is diaphragm. Diaphragm is nothing but phrenic, so this is phrenic. Costo means ribs. So between ribs and the diaphragm, there is this angle which is called as costophrenic angle. Similarly, this is heart and this is diaphragm. Okay, between heart and diaphragm, we have one more angle which is called as cardiophrenic angle. So we have costophrenic angle and cardiophrenic angle. So in pleural effusion, first and foremost, this costophrenic angle. Normally, if you see this costophrenic angle on both the sides, it is acute, it is sharp and acute like this. But here in pleural effusion, this costophrenic angle becomes blunted. Or we can say this costophrenic angle appears either blunted or it appears as opaque meniscus. Okay, just like opaque meniscus, it appears. Meniscus is, this one is called as meniscus. So it appears as blunted or opaque meniscus. So for this blunting of costophrenic angle to occur, at least 200 to 300 ml of pleural fluid should be present in the space, pleural space. In order to fill this recess, at least 200 to 300 ml of pleural fluid is necessary to fill the angle or fill the recess. Now, if this pleural fluid is large, what happens? So if you see, this is the normal lung, left lobe of lung. Similarly, we have the right lung. This is the right lung. This is the left lung. Okay, this is the diaphragm dome. This is one more, and this is the cardiac angle. Okay, now this is the rib cage. Now, if there is, this is the recess. Okay, if there is fluid in the pleural space, number one. Okay, this fluid will be something which is not normally present. Okay, this fluid will push the lung. First, it will push the lung, okay, towards the opposite side. So this will exert pressure and even heart may also be pushed towards the normal size. So the mediastinum or the heart and trachea, these are deviated or shifted to the opposite side of the pleural effusion. That is, they are shifted to the normal side or they are shifted to the opposite side. Okay, that is one important thing, and you will see opacity, or actually it is not opacity, you will see blunting noted at CP angles. noted at noted at costophrenic angles. Blunting is noted at costophrenic angles is also seen, and mediastinal shift is seen to the opposite side. These both features will tell that there is a pleural effusion in that patient. Okay. So if you see in the beginning, this is a very less volume of pleural fluid. This is almost 200 to 300 ml of pleural fluid present in the pleural space, which is almost moderate pleural effusion. And here if you see, this is so massive, whole approximately, sorry, this is 200 to 300 ml of pleural fluid is present here, and here at least 2 liters of pleural fluid is present. Here it's almost 5 liters, or entire lung field is filled with pleural fluid, and this is pushing the heart and mediastinum to the opposite side. Okay, so that is what we have seen here. The mediastinum and trachea will be pushed to the opposite side, and there is blunting of the costophrenic angles. Blunting of the costophrenic angles is noted.